Welcome back to Edu Space, your career choice. We're now here at the offices of our professional who's going to tell us more about Chinese medicine and acupuncture. So come with me and I hope you enjoy this one. There are 5 departments in the center, including Chinese medicine and acupuncture clinic, stroke rehabilitation clinic, Chinese medicine pharmacy, yoga nadi studio. Their main goal is to become the best Chinese medicine and acupuncture clinic in South Africa. Dr. Wu, welcome to Edu Space and thank you so much for having us over.
Thank you. It's glad to be here and it's an honor. Thank you.
Thank you. Why did you choose acupuncture?
When you're talking about this, I would say I choose Chinese medicine because, as we said before, acupuncture is a branch of Chinese medicine. But when you take why I choose this field is I like Chinese culture, and Chinese medicine or acupuncture is actually in our daily life. Like we eat, the food we change during the seasons. So, and what's more, why I choose specifically is actually the family and the 5th generation who practicing in my family Chinese medicine acupuncture. So it's from my great-grandparents. They practice Chinese medicine, and my grandparents, my father, and me. So it's just like family.
What kind of ailments does acupuncture heal?
Mostly in acupuncture or Chinese herbal medicine, mostly we can use for all ailments or all diseases. But when nowadays, like before 19th century, we don't use any tablets, any Western medicine. We use Chinese medicine and acupuncture for everything. But nowadays, when you specifically talking about acupuncture, we use mainly in 4 areas: neurological problem, such as stroke or stroke rehabilitation, or facial disorder. The second is pain. No matter your neck pain, your body pain, or your lower pain, or it can be your stomach ache. So for pain field, we can use acupuncture. The third is gynecological problem. So like someone goes dysmenorrhea, like painful menstruation, we also can use. The last one is sports injury. In sports injury, especially in acute stage, we can use acupuncture to help. That's mostly the 4 aspects we use mostly.
Do you diagnose diseases or do you heal according to symptoms?
We do diagnose according to the diseases, but also the symptoms and signs. And also our diagnosis method is very different from Western medicine. So we normally don't use lab tests, we don't test your blood, we don't use those kinds of stuff. How we diagnose your disease is according to 4 methods, which is observation, to see your appearance, your face color, or your shape, your tongue color. The second is asking your questions, your complaints. That's from your symptoms. And also we see some signs from you, and also hearing. When you speak to me, your voice, how does your voice reflect on me? How do I feel? Is it high or low? It can indicate different conditions. The last one is taking a pulse. The pulse from here, you can tell your condition for your internal organs. So we combine all these 4 methods to conclude symptoms, and then we treat the symptoms. So it's a group of symptoms and signs.
Are acupuncturists considered as doctors?
Yes, we did. So in South Africa, specifically here, we can use the title of a doctor, and then we are allowed to issue the medical certificates. We can apply like practice number as the medical doctor here, and also the fees here are medical aid accepted.
How has acupuncture evolved over the centuries?
There's some theories at the beginning. Acupuncture or Chinese medicine had been constantly practiced for thousands of years. I know there's some theories how we know how they discovered. They might be someone they injured before, and then accidentally something prick on specific area of their body, and they got relief. So just the experience at the beginning, and then years after years we got experience, and they come to a theories. And the theory keep developing now, and now we use this theory to guide our daily practice.
What would you add in acupuncture, and what difference would you do?
It depends on the disease. Sometimes we use acupuncture, which is the needle stuff. Sometimes we use the herbal medicine, and sometimes we use cupping or toina, which is kinds of medical massage to relieve or to help the circulation. All Chinese medicine, we talk about the theories why we are being sick. It's very different from the Western medicine. So it's not infection, not bacteria. We talk about imbalance. So all we do is to make you to be balanced.
Now, our lecturer also mentioned cupping. What is the purpose of it?
You know, when you cup, we use a glass to suck on your skin, and you increase the pressure there. So you also can increase the pressures on your meridian. So it's very similar to the pipe. When the pipe block there, we will put a lot of water there to increase the pressure to make it more smoothly. So same when there's something blocked on your meridian. In Chinese medicine, we say when there's a pain, there's a blockage. So it might block somewhere. Then we use some method like acupuncture or cupping to increase the pressures on your meridian to make the flow move better.
Is there any medication put in the needles?
The answer is no. You know, from the beginning, we use the stone needles, which they sharpen into a needle, and then the bone needles. And later on, we use gold needle or silver needle, which is very expensive. And nowadays, we use stainless steel needles. And all these changes, but there's only one thing that hasn't been changed. There's no medication there, only pure stainless steel.
Can acupuncture heal a new disease?
Oh, yes. You know, it's a very interesting question. Sometimes people, they ask, it's a very old medicine, can they treat a new disease? The answer is yes. We got a very interesting case in 2002 to 2003, the year. All over the world, there was an epidemic disease, SARS, there. All over the world, especially in China, it's very severe, and a lot of doctors, they die from the disease because we don't know what infection there, what cause there. And the case there is in some area, especially the southern part of China, we use the herbal medicine, the Chinese herbal medicine, to treat the patient. And afterwards, after years, the disease is gone, and then we got a review. We saw the patient with herbal medicine treatment, the Chinese medicine treatments, they got the least mortality rates, they got the least sequela, they got the least. When the day they stay in the hospital, they got the shortest one.
How many treatments are needed until one is well?
It rather depends, you know, it depends on individuals, also depends on the diseases. Also, the second is it depends on the acute stage or chronic stage. If acute stage, we may fix them like much quicker. But chronic stage, we need much more time. Like if frozen shoulder, someone couldn't lift their arms. If acute stage, we might fix them in once or twice session. So, but in like shoulder rehabilitation, which we mentioned before, it might take 1 to 3 months, 3 months. So it rather depends on disease.
Are there certain people that can't do acupuncture?
Theoretically, the answer is no. But on some patients or some people, especially in their certain periods or certain periods, like women who's pregnant, in some specific area, we won't use acupuncture. Like pregnant, we don't use the area in lower back because it's very easy to cause miscarriage. So everyone can use, no matter infants or senior people, you can, but just some area we need to be careful.
Is there great demand for acupuncturists in South Africa?
I would say the demand is increasing, and because acupuncture is a very new treatment from East. It's totally different from the local culture. So the demand, I can say, is rapidly increasing. According to the data from our clinic, we can see years after years, the patient, the demand is increasing a lot.
Doc, my last and final question to you is, what is the earning potential for an acupuncturist?
It will depend on your experience, your skills, and your reputation. You know, in South Africa, we are not allowed, as a doctor, we are not allowed to advertise yourself. So how you get the patients in is the reputation from mouth to mouth. So it rather depends on this, but just in general, from the first to second years when you started, it might be, your income might be more or less 10 to 15,000 per month. Like 3 to 5 years, it might be 50 to 80,000 per month. And if you practice longer, it's very possible to more than 100,000 per month.
No, I'm definitely changing my career. Well, it was lovely chatting to you. Thank you so much for having us.
Thank you. Thanks.
What an insightful day this has been. I definitely learned so much about acupuncture. Before this, all I knew was that they stick needles into your body, and I thought it was pretty painful. But man, was I wrong. Now I know that it's healing for the body. Unfortunately, we have come to the end of yet another spectacular episode of Edu Space, your career choice. But you can still tweet us at Soweto TV channel. Don't forget to use that hashtag EduSpace. Share with us your thoughts and your views and what other careers you'd like us to cover. But for me and the team, it is bye-bye for now. Until next week Monday, same time, same place. Edu Space, your career choice.